So let's shift to the next article and you can relate it with GS paper 2. So UPSC loves to ask this type of interrelatable question. Like here, there is a conflict which is occurring in Manipur. Okay, and how this conflict is affecting the healthcare of that region. So UPSC may ask this question, so kindly prepare this in that way. Okay, and when we talk about this Manipur violence, you know that from 2023 it was started and still there is instability. And again, we have the news that fresh violence cases had already been started. So this is impacting the social conditions of the people, the mental or the political conditions, as well as challenging the internal security. But our focus here will be how these conflicts is impacting the delivery of the healthcare system in that region, in that state. So first of all, we have provided you the basic concept that from 2023 onwards, this Manipur conflict was started, and it was a conflict of ethnic community, like two important community. One is your Mathi community and another is your Kuki community. So the conflict was between these two communities and it was expanded over the time, and still it is in that mode and there is no stability and peace. However, government is trying to maintain the peace and stability. Okay, so that is one thing. Now we will be understanding the various impact on healthcare and the people's life. First of all, whenever there is a conflict, so people have the fear. Okay, what will happen? So because of this fear, the medical professionals, okay, they resign from the job. Okay, and because of that, there is disparities in the accessibility. And how this disparity is causing, because in Manipur many important and best hospitals were located in the capital, that is Imphal. Okay, but because of this conflict, the patients are not able to visit there even in the emergency need. And also the healthcare professionals are resigning, and hence we have the lack of a specialist and the other infrastructure in other district as well. So this is two important thing that is causing disparity in terms of accessibility. And there is a case study like Kangpokoi district hospital. Okay, it is struggling with the limited resource because the supply chain is also getting restricted. And apart from that, the displacement of the communities is also disturbing the already weak healthcare system. Okay, so we have the Imphal as the capital of Manipur, and we have the other district. Okay, so the majority of the best hospitals are concentrated in the Imphal, but when we talk about other district, so there is low quality district health care. And even what, there is absence of blood banks and the operation theater emergency hall. So this is leading to much more crisis. Hope you understood one aspect. Now there is also exodus of medical professionals, like these medical professionals, many of them had already resigned. Okay, and apart from that, the leftover professional, they are facing the heavy workload because the amount or the quantity of these medical professionals had already shrink. So they have to work harder, they have to work overtime. So that also affects their mental stability. This is one another thing. And it also impacts the public health services and patient care as well, because in this conflict patients are coming already. Okay, so these professionals need to handle it. So there was a statement from an anesthesiologist. Okay, and he said that only a handful of MBBS graduates are managing everything. That means very less number of professionals are there who is serving in the hospital, who is serving in the healthcare. Okay, Then apart from that, financial burden on the patients is also increasing, and that is leading to more out of the pocket expenditure. And you can observe that in Manipur, the households do not have much more health insurance. About 96.4% population, 96.4% households in Manipur, they do not have the health insurance. Okay, so that means if there is a health crisis, they need to pay from their own pocket. This also increases their out of pocket expenditure. And kindly remember that there is lack of availability of the hospital. So if people are going to the private hospital, they will charge extra. These hospital may exploit the people. Okay, so that is one thing, and that adds the economic impact. Okay, so that is the scenario. And there is a statement from a cookie doctor that most people in Manipur need to pay much of their healthcare need from their own pockets. So we are seeing the financial burden on patients as well. Now there is the logistics and supply chain issue. You have to understand that for a hospital to perform, there is a need to have a medicines, there is a need to have the tools for the operations and many more equipment. But if there is a region which is in the conflict zone, so the supply can be affected. Remember to the international context, like in the Israel Hamas war. Okay, so even there was the request to have an entry of the aid supply from the Mediterranean region to the Gaza, but it was blocked. Okay, so try to link that. So because of that, there is also the supply issue. The important medical resources is not available, like blood bank supply is lacking. Apart from that, even if there is a availability of the blood supply, but it is being given based on the patient's identity, whether you are that community or you are this community, as well as the location. Okay, and there is a statement from the cookie doctor that the logistics of the transporting medical supplies from Imphal have gone heavier, that means have been disturbed. So that is another impact on the logistics and supply chain issue. Then we have the problems, we have the crisis in the relief camps. So when this crisis occurred, so people were shifted to the safe relief camp, but there is overcrowding, and in the overcrowding there is a lack of sanitation, clean water, and also there is no proper nutrition. So this is affecting the women, the people, the children, and this can also lead to a spread of infectious disease as well. And specifically for the women, there is a lack of privacy, menstrual hygiene. Okay, this is affecting the women's like credibility as well. Okay, so that should be like very much bigger repercussions we are seeing. And there is a statement from a report that relief camps are not receiving even the government aid, but they are getting money from the donations by the NGO. Okay, so the government aid is also lacking here. So these are the concerns we have highlighted. And one thing you also note that in Manipur there are many tribals. Okay, they lives, and apart from the Metis and like Cookies tribe. Okay, so these tribals do have rare disease. Okay, and when there was peace and stability in this region, so these tribals were visiting to the hospitals, to the public hospital or the private hospitals for the treatment of rare disease. Okay, but because of the conflict and the fear, these people are not getting the medications because they are not visiting the hospitals. Okay, so there can be the serious health complications on these people, and even they can cause death as well. So there is a statement from a postgraduate resident who is living in the Imphal. They said that the sufferings of the people, specifically who are facing this rare disease, can be much more disastrous. Okay, so you can understand the deeper impact of this conflict on the healthcare on the people. And apart from that, there is a medical education crisis. How? Because the education or the institutions are closed. Many students left this region and went to their different state. Okay, and this caused the decline in enrollment in Manipur medical colleges. Undergraduates, postgraduate students, they are dropping out. Okay, so high dropping rate became. Okay, so this can affect their career, their futuristic career as well. So there is a medical education crisis, and that can lead to career crisis, and that can affect the future of the people or the future of the student. Okay, so many students, they are quitting their seats fearing for their safety. And then we have the missing records and lost treatment. Because of the violence and displacement, there was loss of many health records for the patients and even the essential documents, because they were being burnt, and many more negative repercussions was there. Okay, so let's say if there is a HIV positive patients and their documents were burned, their documents were lost. Okay, and they do not have now the antiretroviral therapy cards. These cards basically have the records, have the track records of different treatments which were going on, so that based on that record, proper treatment should be done. So maybe their records can be lost, can be burned. Okay, so this again creates additional burden on the healthcare professionals and the patient as well. Okay, so there can be the increasing chances of risk of error, and in this type of disease there is more precautions and needs to be taken care of. So in conclusion, we can say that this conflict is expanding in different dimensions, whether it is in the education, whether it is in the health, whether it is in the social, whether it is in the peace and stability, whether it is in the internal security. So that needs to have an urgent resolution, and for that sustained intervention and support is needed. And also there is a need to call to action for the government as well as NGO, so that peace, stability and security must be fulfilled, and we should serve, we should protect the nation, the people, the community. Okay, so that is the end of this article, friend. Hope you understood. Now you have the prelims bite session, and here you have to solve the prelims question. Kindly pause the video and give your answer in the chat box. So thank you, friends. Thank you very much for your participation. If you are liking our initiative, please do like, share, subscribe. Thank you.